A big shift is coming in just 2 weeks for thousands of Iowans who rely on the state for health care. 4 private companies will manage the care of the 500,000 Iowans on Medicaid starting January 1st. But some say the change at the top could have a negative impact on the people who need this state-provided care the most. KMTV Action 3 News reporter Kevin Bowden has this story.
The Medicaid system in Iowa oversees the care and services provided to people with developmental and intellectual disabilities. A variety of agencies help those folks learn life skills. But now they're worried they might have to cut care to people who can't afford to lose it. At Vodek in Council Bluffs, staff teaches job and life skills to clients with varying levels of disabilities. It's a safe, welcoming place.
Hey, Derek. Joey.
Each of these clients has an individual treatment program. Vodek staff provides those services and then bills the Iowa Medicaid system. With the coming changes in Iowa's Medicaid program, providers like Vodek worry they'll be paid less for the same services.
Oh, sure, we're afraid.
As Iowa shifts Medicaid management into the hands of 4 private companies, the state is implementing a new reimbursement system that changes how companies will be paid based on a complicated system that averages out the cost of care. Vodek CEO Steve Hodap says the new model will result in lower payments for more involved services provided to people with severe disabilities.
So, in other words, there'll be some providers like us who are providing one-to-one services now, and for whom the new rate structure is not going to work very well.
State officials say the rate change isn't designed to cut costs, but increase billing efficiency.
Previously, we had in place many thousands of different rates. This is not a great business model for being able to do reimbursements. So this is something we've looked at for some time, being able to streamline that process a little bit more.
The state adds its research shows the impact of the new rates on providers will be low.
When we look at the data on the average weighted rate, we see less than a 1% change for the majority of our providers.
But Hodap fears the impact of the cuts may be bigger than expected, and his clients will suffer for it.
All I know is that we have some consumers for whom we're going to get paid significantly less in January than we're being paid in December, and the expectation is that we provide the same service. And it's just, I don't know how we're going to be able to do that.
Vodek has appealed the reimbursement rates to the state and is now awaiting a response. Now, the state and the 4 companies it's hired to run the Medicaid system say they're committed to maintaining the same level of care for everyone in the system. Kevin Bowden, KMTV, Action 3 News.
To help Iowa Medicaid recipients adjust to the changes, the new plan includes a safe harbor period. It means providers will still get 100% reimbursement for services until April 1st. The move gives Medicaid recipients time to get questions answered and shift over to new providers if needed.